Thank you, everybody, for jumping on this webinar today. We're very excited to talk about the future of health tech, really leveraging user-centered design in the process. I'm going to make a couple quick announcements before we jump in. Actually, John and I are also hosting. If you happen to be in the Boston area, I'm going to show this here for a second. A health tech mixer next Thursday in Copley in downtown Boston at the Loft offices. It is together with the Design Week, so actually parallel with the Design Week and IDSA Medical Chapter, where John is the chair, as well as IDSA Boston, where Saloni, who's sitting next to me, is the head. And we're super excited. We have about 90 people signing up so far. So there's a couple more slots left. So if you're interested in the area, please join us and spread the word. It's an informal mixer of health tech, human factors, and engineering folks that talk about topics like we are talking about today. And also, the next webinar is on May 28th. It's about the transformational power of human-centered ecosystems. We actually have a great set of panelists. Robert Quintero from Amazon Robotics, our very own Clotilde, who's running our product design practice at Loft, and Alison Advur from Novo Nordisk in Denmark. So we're going to have people from the West Coast, East Coast, and Europe call in. Also, hold the date. We have an upcoming webinar, May 22nd, where we're going to talk about the future of healthcare and harnessing AI for breakthrough opportunities. But let me get started. I want to make introductions here really quickly. We are super excited that we have this very international crowd here. We are having folks from Madison as well as the Boston area calling in, and actually a couple of people from Europe are calling in as well. So if it's late for you guys, sorry about this. We try to keep these at a reasonable time for everybody. Amy is actually an innovative strategist, and really, her practice started as a designer, but really she is much more on the front end of innovation, and really is looking right now at kind of the intersection of technology, consumers, businesses, and technology trends, and currently working at Stryker. And John, who's calling in from, Amy's from Madison, calling in from Madison. John is actually calling in from Boston. He is, as I said, the chapter head for the medical chapter at IDSA, as well as, human factors in UI, UX, a professional working at Smith & Nephew. And then we have Rochelle Ritzenthaler, sorry, I'm butchering this name, also from Madison, who is also a designer. Actually, all three panelists are designers by trade, who's working at UW Health and comes from a service and strategy background. I want to open it up to the panelists a little bit and maybe talk a little bit about kind of the crossroads of where we are right now, and maybe we can kind of cover the topic area. I want to start with Amy. When I called you to be on this panel, what was your first thought?
Ooh, it fit in that category that we like to call big wicked problems. That was my first thought. Lots of noise in this space, lots of tools in our toolbox that we need to apply more than ever in order to think about the future of healthcare and health tech and where these new technologies fit in.
Excellent. Yeah. And so, John, I mean, you and I know each other for a couple of years now. I would say 2, 3, maybe. Maybe a little longer.
I haven't been counting, so.
I know. At our age, we forget these things, right?
Yeah.
But I mean, I think you're pretty active in the human factors. I would say industry, especially in the Boston area. I think I run into you in a lot of the events, from DMI to IDSA to health tech mixers. Where do you see people are talking about these transformational changes the most? And like, do you feel it's talked about enough or not enough when you kind of see interacting with folks.
Yeah, well, I think if we put it on through the lens of the design community, I think we're all very much dealing with similar types of growing pains. There's a lot of there hasn't been I think a level setting of what some of these terms and technologies mean for every player in the space. And so I think part of what we're trying to do is wrap our heads around what we're dealing with here. It seems like, and especially AI, which you're at a conference today, seems to have blown up the spot in the past 12 months. It's just kind of, where did it come from? Oh my God, it's here. And so I think there's a lot of scrambling going on.
I agree. Yeah, and it's interesting, right? Because I feel that there is kind of this you're oscillating between what can how exciting will the future be to, we're all gonna get killed by robots, right? So it's like this, and it keeps going between the two, sometimes in the same conversation. So yeah, I think we all are probably at in our lifetime a pretty transformational shift in our careers, wherever we are, even if we start out, getting into the career, or as some of us are a little more have longer teeth in this. We're probably looking back and looking at when the internet arrived, how that actually changed what we thought of like our job or our life. So I think this is one of the similar moments. I mean, yeah, John, thanks for pointing this out. I'm at an AI conference at MIT today, and all morning, we talk to startups and founders about the transformational change that's happening right now in the greater industry, and obviously this is filtering down to health tech and patient care, which actually patient care is something I want to talk to Rochelle about. So we had a pre-call about a week ago, and I think we talked about this idea of, you're a large-scale hospital system, right? I would say 10, 15 years ago, nobody with your background would have been in your position in a hospital system. So there's a lot of change that has happened in the last 10 years. Maybe you can talk a little bit about your journey and how you feel, this is evolving.
Yeah, absolutely. So you're completely right. I was just involved in a white paper that's being produced by IIT, and they had interviewed health systems across the country and various designers in different roles. And one of the things that was really interesting about that was that I think it was over 75% of those designers did not have roles within the organization 5 years ago. And I think a lot of this has been spurred by the pandemic in some ways, where we're starting to realize the role that human behavior and our pain points and our motivations and our challenges. We can't just create the solution and people will come. We really need to be thinking about this in a human-centered way. And so a lot of health systems across the country are starting to think about this, but we're very much in the early stages. I think, as I look across, with John and Amy, I know within the consulting industry, that's my background as well. We've had, this history of human-centered design when we're looking at products and things like that. Within healthcare, that's not as much the case. So it's been really challenging and rewarding and all of those things to work on bringing this to healthcare.
Mm-hmm. Yeah, I think what's interesting is I'm glad you're bringing this up. I think, John, you mentioned this last week, actually, that the FDA really put human factors, or human factors engineering, usability testing, the human at the center, at the forefront. As you know, obviously, when you are in the medtech space and you want to get a 510(k) pre-market clearance, you're now required to do human factors testing, and human factors engineering has become a really strong part of any company's moral fiber to really solve some of these challenges where technology meets humans. And yeah, maybe John, you can talk a little bit about how you feel that the technologies are evolving and how the human-centered side is now really much more mandated and much more prevalent.
Yeah. I think there's two sides to that question. One is the products as a manufacturer, the technology that you're marketing and developing for sale. And then there's also the tools that you can use internally to be able to identify things or be more efficient that you may not have been able to do in the past. And so, you mentioned the FDA. That's one part of it. The FDA does have guidance on human factors, which I think most of us probably already know. There's the international standards like 62366, and then now NMPA, China's regulatory agency, has released their human factors guidance and usability. The frustrating part, for those of you who are in the business know, it's not necessarily, it's called guidance. It's not a hard and fast requirement. And so that is something that we struggle with as practitioners, is just trying to convince either our business partners or our clients to just allow us to do some of the things that we do well. And I think that's where there's some headwind as to just making sure that the manufacturers in the healthcare organizations, whether it be a hospital system or a manufacturer, they kind of want to do more than just the minimum. There's there's things that there's so much technology out there. There's so many products. Everything is moving so fast. I think even things are moving faster in the healthcare space, even though it takes a little bit longer than the consumer space. A little secret to some of the success I've had on my professional front is I kind of use the human factors bit as my shield, and I sneak design in through the back door. When I joined Smith and Nephew, they were looking to fill and build human factors, and I said, I'll come along for the ride as long as you allow us to build out our design capabilities as well. And fast forward 5 years, I think some of the fruits of our labor are going to start to hit the market, or are hitting the market, and the organization is really starting to come around to understand the value. So what I'm trying to get at is there's still a lot of room for growth. There's a lot of runway, as they say, ahead of us. And I think even those of us in the business are trying to grasp what this new technology means and how we do business. Yeah, there's a lot there to unpack. So let me know if you need me to go down that rabbit hole even further.
Well, we'll do a little cycle. I wanted to cover a little bit, and maybe Amy, you can talk about this. That a lot of people on this call probably are, new designers, maybe even still in college. They might be interested in health tech and life sciences. They might be interested in kind of pursuing a career in medical device development. What is kind of your advice to, what is kind of the North Star for a designer these days in the age of AI, in the age of regulatory burdens, in the age of kind of evolving technologies? If you would be Amy, in art school, what would you give yourself advice right now?
Wow, that's a great question. I should maybe clarify too, my background is actually in research and marketing. So maybe some things that come to mind, and I don't know that they're necessarily different based on any industry that you're in. I think it's some of the same things that you might hear whether you're in retail or CPG as a designer too. I think it's extending beyond your core skills and the toolkit that we hopefully are all creating mastery around, and thinking about the way that we manage people, the process, and influence decisions as we go through that human-centered design process. I think there's a lot of amazing work that exists in the world that doesn't see the light of day just because as designers, we don't always advocate for the work as effectively as we can. We don't have allies. We don't think about the change management that needs to come along with something. So broadening that toolkit a little bit to think about that process and also the larger business model that you're impacting is really important. Mm-hmm. Some of the most difficult feedback that I've ever gotten in my career that's stuck with me for a good, I think back 15 years now, was that I was too idealistic. And I think that was a really nice way of my leader at the time saying, you have great ideas, but you're not thinking about the bigger picture and what it's going to take to do that. So my frustration with things not moving fast enough or not achieving that bolder, braver vision needed to be tempered with reality and thinking about what it takes to move a whole entire organization in that direction. And I still struggle with that. I'm sure Rochelle and John do sometimes too. Like, as much as things are moving really fast, we're not moving fast enough. But we're all humans and we're all trying to take care of ourselves at the same time too. So that human-centeredness can't just be about the HCD process. We have to consider the humans, back of house and back of house with that too.
Right. I think one thing I always see, I'm glad you're bringing this up, is this power of storytelling, right? So change management is nothing without storytelling, and really, the more you can kind of bring the human along in a large organization or a small organization, the more you can tell that very individual approach, and then make a relevance to a larger scale, the better off you are in kind of everybody's a human, right? And I think the quarterly earnings are only one metric. The wellness of our organization, I would say also the cadence of innovation and disruption is creating a lot of angst, right? It's always easy to fall back on like, oh, we're gonna make money. There's gonna be a business model. A guy that I met many years ago always said to me, and I think my guiding North Star has always been like, first you make friends and then you make business, right? So it feels like it's a lot easier to kind of convince somebody of your cause if you have a good story and a relationship that supports that story. So yeah, you're right. And I think engineers sometimes maybe are too much on the like analytical side, and I think designers can fill that gap of that storytelling void within an organization very well. I've always been kind of like when I present to our clients, or even I spent half of my life on the corporate side, I was always kind of really almost empowered to tell that human-centered story through my design practice. So I would say if anybody's a fresh designer here, hone your storytelling skills, go to presentations, don't be afraid to raise your voice. And, if you're passionate about something, wrap it in a story that somebody else can relate to.
Yeah, I was just going to say, if you haven't seen the presentation by Mike Montero about the 13 mistakes that designers make, which is a little crass and not always safe for work, I've always found that to be a really good YouTube talk to visit every once in a while, just to remind myself of where that frustration can have some good output if we take some of his advice.
Yep. Yeah, John, sorry.
Yeah, no, I was just going to reiterate how important that is, the comments that were just made around storytelling. The funny thing is that I think a lot of designers have missed, even I myself have to remind myself, is we kind of preach a certain way of working, but we sometimes don't apply it to ourselves and the way that we communicate. And now that as more and more products are becoming, let's just say technology, right? There's more and more technology, for the lack of a better term. Everything is interconnected. Things become invisible. The technology, the line between a product and a service gets blurred more and more, and it gets harder for people within an organization to really understand what they're driving towards. And so that's where I think we as a community, as a practice, really need, on our daily jobs, need to really up our game on selling the vision and getting people to understand what we're doing, and be comfortable with repeating yourself over and over again, and having that same story told. Because a lot of people lose sight, if you have developing a product and you're working on it for several years. Does everybody remember what you're trying to solve, what you're trying to work towards? So anyway, not to belabor the storytelling aspect of it, it's more important than, actually, I've come around to it. There was a time where I kind of was like, well, how important is it? Does it resonate with people? But then you circle back with folks, and that's the thing that they bring up: your ability to tell a story, your ability to communicate what the vision is, and kind of play into a leadership role.
Right. And I feel, especially if you're talking about formative testing or formative research in, medtech, it's really simulated and use environments can be a great enabler to tell a story most effectively. What are really the, hazard related use scenarios? How do you really interact with the micro elements of your creation, in a context of use, and then getting that feedback is super helpful. And then actually turning around that feedback and then showing it to the leadership, but also the FDA is really, building confidence, in you, because you really understand, how users, how patients, how, key stakeholders in the value chain are interacting with devices, services.
Yeah, I would say within even the healthcare systems, like take everything we've said and amplify it by like 1,000 times, because people who can visualize complexity and also communicate through this complexity are so valued. Like, it's not like we're able to sit there and have a conversation around, even a complicated product. Like, one product service experience is like this part of an overall journey, right? That we're trying to really understand. And then you think through, there's so few journeys that are linear in our world or similar to each other, unless maybe some cases like a pregnancy or something, you're able to kind of get through the 9 months. But most people have these health journeys that are all very unique to themselves. And so once you start to get within the healthcare space, those tools are required, and the sophistication of those tools has to be amplified. We're not there yet. Like, I think we're still using tools that are built for, that one persona working through a journey map. I'm dumbing this down obviously for this conversation, but to look at ecosystems of care, we really need to be able to visualize that and communicate it in ways that we have not gotten to yet.
Yeah, and I think, thanks. I'm really glad you're bringing this up. I had a conversation with Allison actually a couple of months ago, and one thing stuck with me is, he said, healthcare is so complex because there's so many stakeholders with various interests, and also everybody's trying to do the right thing. At the same time, it's just such a complex endeavor. There's, it's a service design blueprint with really infinite amount of stakeholders. Therefore, it's really hard to boil it down to a model that can actually be even comprehended with, right? So, you pull one lever and out of a sudden everything else gets shifted, right? So, it's really, for us who are in it, it's an endless journey somewhat, right? And you're trying to, optimize certain aspects of it, but it's in a sense, the reason why, and now technology is coming and disrupting things, right? So, it's really interesting, and I think I would say the values that technology are bringing have to be carefully considered with a human-centered approach, because just applying technology by itself does not solve or change anything.
Yeah, and to your point about the quantity of stakeholders, so every process or service that we design with technology, we have to sit there and take a step back and say, okay, now what happens if there's no technology involved?
Right.
Can we still get this done if the person does not have a smartphone, if they don't have a computer, if they don't have their own phone number, and they're living in a shared housing system? So, the technology ends up being nice and wonderful for some of our population, but we always have to look at it then without, for another portion of our population.
Right. Yeah. I want to maybe do a little bit of a dive on technology, because I'd love to get all of your perspective on this. But, there's two sides, as John said. There is the optimizing your own work with AI, right? But then there's also leveraging AI to better, imaging, or better value chains, or bettering robotics. Now, surgical suites are AI enabled, and, imaging platforms are AI enabled. And, where is, this, I think there's this emerging concept of a co-pilot, right? Where basically AI will be the guiding, friend of your nurse, of your doctor, of your, of your patient. How do we as designers design these systems to be as human-centered as possible?
I think John alluded to a little bit of that with simulations and testing. I think that's a big part of that prototyping becomes even more important for us. And it's not just for the sake of the formative summative, but really truly thinking about that divergent piece of the design process and where that fits in for different people. Rochelle's getting on it too. Not everybody's going to be in the same place in terms of where that technology can meet them. So when we're thinking about our user groups that we need to test with, that gets more complicated. The stakeholders are much more nuanced, and the potential fallout of something not going well is so great. That
Right.
first really poor experience with an AI enabled device or an OR co-pilot type of situation, that really can have lasting experiences. And if we think about some of our first experiences with the technology that we probably take for granted today, you might have said, I'm never going to use an iPhone, I'm never going to use an iPad or something like that because you saw something or something didn't work. It took a while for some of those things to take hold. So we have to think about the long-term implications of that, and also kind of touches on one of the questions in the chat that John has answered about why med device is different. There's a whole other safety and regulatory aspect to this too that we have to consider.
Right.
Yeah, I was going to mention your designers are going to have to learn to synchronize and work better with the clinical group. And if they're not already engaged with them, they're going to have to be, because when you're infusing a product or service with AI, you're probably going to have fewer and fewer 510K submissions, which most med device products go through, which is basically, hey, our product is very similar to the one that we just launched not too long ago, or that one over there that's approved. So this one, in theory, is okay because it's based off of that one, and it's a perpetuation, basically, in a nutshell, what 510K is. But what we're going to have to probably get better at doing is working through some of those clinical trials and some of those more rigorous studies that are going to require some more evidence and data. I'm afraid that I could be wrong here, but a lot of designers maybe don't handle data or big sets of data very well. And I think we need to, as an industry, as a profession, start to really leverage some of that.
Yeah, I think that's 100% right. I mean, I would say not only data, but also the visualization of data, right? How do you find outcomes? How do you synthesize data? And how do you kind of draw conclusions from that? Yeah, I mean, it's also interesting, right, John? I would say that FDA is also becoming more nuanced in how they apply kind of the 510K hammer, right? Now there's like de novo, spins on 510K. There's all kinds of, like, I would say, as AI is emerging in certain sections or certain areas, there might be like a part predicate, and then a part de novo approach where you have to not go through 100% data sets all the time from the start.
Yeah, can you imagine a future where the FDA, your product or service goes through an FDA AI to evaluate it and test it, right? And so, I mean, there's so many dimensions to where this can go. I think we just need to familiarize ourselves with all this stuff. They're not calling it another industrial revolution for nothing, right? Things are moving quick, so.
Yep. No, I mean, I think what's exciting about AI really is this, hyper personalization. We talked about this a little bit, like the ability for a doctor to basically have a patient come in and see all their records and really have them filtered by like an AI model that can really bubble up the relevant aspect, where you don't like doctors have maybe 5-10 seconds, right, to sometimes make assessments, because it's it's a very hectic environment. So AI can really empower and like add value to that. But also, how is that not being blindsided by your race or by your economics, and how do we keep that equitable? That's a super big challenge, right? Maybe Rochelle, you can talk a little bit about that, because I think that's something that you probably tackle a lot in a hospital system.
Yeah, I think like one of the big applications we're looking at for AI is similar to what you're speaking about right now, but it's within the EHR MyChart messaging response. So both Amy and I, being based out of Madison, Wisconsin, we have Epic in our backyard here. So we are one of 3 or 4 health systems in the country right now that are working on using Epic Microsoft AI to do automated responses to MyChart messages. And when I say automated, there's some qualifications to that, right? So a patient might send a message to their doctor, and the AI generates a response. The clinical team can then review that response and say, we're going to use the response that the AI generated. We want to edit that response, or we're going to start fresh and use our own response. So that's one of the very targeted ways we're trying to use AI and see what can happen. It's a pilot within our organization right now, so we're definitely studying the responses from all sides, from our patient side, also from our care teams, and seeing what their sort of happiness level is with this. But I think you can imagine, even the MyChart messaging space is one that's bogged, our clinical teams down. It was something that was it's not in the business model right now, the hours and hours that they spend responding to each and every person's message within, our service standard of that 24 to 48 hours response time. So these are things where we're really trying to look for supports for care team burnout and all of those things to support our teams.
Right. And I mean, whoever has interacted with a chatbot, I would say there is, more give every chatbot as much AI as possible, because it's really painful.
Yeah. And you can imagine, as maybe that nurse that's responding to your message at that point in time did not have the time to go back through all of your medical records for the past several years and know what's going on with you, but the AI can scan that a bit and say, hey, there's something that happened. They had the same message that they asked, 7 years ago. Is there something there with this? We're able to connect the dots a bit more quickly. And I think that's where the power of this is going to be, if we can sift through that data, whether it be written numbers, whatever it might be, and help care teams make better decisions live.
Right. I mean, this whole idea of cognitive load, right? I think, as you're building medtech, a lot of times there's a lot of cognitive load for doctors, for nurses, for anybody that's interacting with technology. If you find a way to have the AI reduce that cognitive load, I think that's really an avenue for success moving forward. And I think the challenge there really is that, within an organization, and maybe you guys can talk a little bit about this, there is not really anybody who's the advocate for minimizing cognitive load, right? There's people that build the technology, and there's people that market the technology, and then the designers are somewhere in the middle, right? So how do you become an advocate to kind of, have a software team, put their resources towards something that is, I would say, somewhat non-tangential with the outcome of the success of a product. It is with what we think of the success, but how do we convince stakeholders that a better user experience, a simpler user experience is worth kind of investing in?
I think that's actually something that is part of, I don't think I'm revealing anything too top secret here, that is a design principle that we work towards, and really thinking about that. The burnout of healthcare providers and nurses is top of mind in so much of the work that we do. And the unintended consequences of technology is something that we need to think about avoiding as much as possible. EHR, EMR has had a tremendous positive impact on the way that we receive and manage healthcare. But we all know too that it's had some unintended consequences as a part with that. So that's something that's certainly in the back of my mind. And I think there was a comment in the chat there, should we, really considering that, should we part of that is a good part of the equation here.
Right. Yeah. John, you wanted to say something?
Yeah, I would love to, a lot of us on the business side, we get wrapped around the wheel or axle on the technology, and we look at it from a technical perspective, which I wish more organizations would also look at it from the patient's perspective. Like when you first show up at a hospital, the experience that you have going through the hospital And I guess that's maybe where Rochelle is kind of playing in that space. Because I had a procedure not too long ago, and you forget that it's such a meat grinder when you walk into a hospital, the process you go through. You got these people that are like, all right, give me your insurance and give me your license, and you're like filling out all these forms, and it's like, why are we still doing this in 2024? Like what? Why do we have to go through these silly processes? And then you get wheeled in, and everything is just it seems so antiquated, and a lot of the equipment's old, and you're bombarded with beeps and squeaks and lights and people running around, and it's just a weird environment to observe it, as if you're as me, the patient, but kind of trying to put my work hat on at the same time. There's so much opportunity. There's just so much opportunity, and it's a matter of just sometimes, does that mean that you need to just lessen the regulatory burden, or do you increase it? I don't know. But I feel like we get in our own way sometimes in making really good experiences, and being able to take advantage of all the stuff that we can. The story that I always try to compare us to is the consumer space, because some of the folks that you're working in a healthcare environment for so long, they're kind of myopic to things, and it's like, well, you're a consumer too. Like you've already seen what good looks like by going to Amazon or Apple or whatever, right? And experiencing those things. So why do we, in the surgeons and the doctors and healthcare professionals that we're working with, they're also consumers too. So in a way, I feel like being in the healthcare space is a little easy, because you can always look at all the stuff going on in the consumer space, and you just say, well, that's the benchmark right there in terms of how things operate, how efficient things can be. So anyway, that's my rant for today.
I think that's I mean, I'll challenge that a little bit, right? Because people always say like, oh, booking your, appointment should just be like getting a seat on a plane. And it's like, it does not matter where I sit on that plane, but it does matter if I'm scheduling, a scan or something that I'm going for a specialist for. I don't have the language to know exactly which person I need to go to and what specific scans or tests that I need to have done. It's the complexity of like sort of booking that will never, especially particularly when we're talking about specialty care. Obviously, when we're talking about primary care physicians and things like that, sure, like consumerism, yes, we can figure that out more, and we should. But as we get into specialty care, it's not like the consumer has all the information, like they have the search criteria that they need to begin with. Very often they don't, or they think they do, and they still don't. So it makes it a challenging process. I think even the language, though, I love what you're saying, is sort of that consumer-centric language. I think there's a little bit of resistance within the healthcare industry to use the word consumer. And you're starting to see it more, obviously. But there is that sort of, it's not a consumer, it's a patient. It's like, well, they're both, right? And so I think there's some qualifications to that as we're working through design processes.
Well, what's interesting is, this is a little bit of a tangent, but like, there's deregulated industry, there's health, like hearing aids, right? Used to be very regulated, now are somewhat deregulated. They're becoming much more of a feature benefit value equation, how do you to market strategy. Like, I feel like as you're deregulating industries, they probably have to be more consumer facing, right? And that's
More
a really
service too, I think.
Yep, exactly. Yep. So maybe specialty care doesn't have to be 100% consumer facing, but as you're getting into like primary care, as John said, maybe there is you walk into a hospital, it's like your cashless checkout. You just appear, don't have to sign any charts. You get to the right location. I think as designers, we're great in envisioning these things a little bit better, probably over time.
I mean, I go through airport security in 30 seconds flat, right? I go through clear, they scan my eyes, I show my phone, I'm on my way, I'm done. Like, anyway, I think there's so much opportunity. It's just allowing, I think the startup industry is probably going to be the ones that are going to start to really crack those nuts. But as we were talking about last week, what might be worth mentioning here is, would you rather interface with an AI system or technology? Let's just say technology instead of AI, or would you rather have the human element? And I think some people are under the assumption you might be better off with the human, but actually, I don't know. I'm on the fence here. I think I might prefer dealing with the technology as opposed to the. I have a long last name, and how many times I have to deal with people misspelling my name, and I've received other people's medical bills in the mail because they had a nowhere close, but somehow I get them. I would rather interface with technology because I know it's going to be consistent.
Yeah, I
Yeah.
think that that continuum of where technology is really boosting human performance, or where it's helping to create more efficient processes in the background, given that we have a worker shortage across the board. It's definitely one of those it depends types of answers. And each experience is going to be a little bit different. And I think, John, going through airport security, you have more choice than most people would. Like, I don't have a lot of choices of which healthcare options I even have unless I were to buy my own healthcare or try an HSA or something. Like, it's that North Star of, or one of the North Stars of trying to consumerize it is great, but it might be a little bit too idealistic if I think about the comment I made earlier about really how realistic that is for people. Like, would I pay a little bit more, like, however many hundreds of dollars a year that Clear is, to walk into UW Health and not have to go through all that rigmarole? I don't know. I'm already paying so much for it in the first place. Like, that's a lot of questions to think about. And just like Rochelle said, there's all these different personas and the customization that we've talked about. That's a really interesting thing to think about. Like, how you get to customize that experience and what people will actually choose if given the choice, if truly given choice.
Yeah, we did some interesting research. I guess it was last year, the year before, where we spoke with a number of people with cancer and their families, right? And the experience that they were having and working through their journey. And one of the things that came out of that seems to be holding true for other areas within our practice is we built sort of a complexity and intensity framework. We're strategists, the 2x2 situation. And I think, in terms of like where to add technology, it seems pretty obvious when it's a low intensity, low complexity moment. All that check-in work and the forms that you were doing, John, before you arrived there, those should have been happening before, like open up the MyChart, get the check-in completed, sign off on everything, you're in the door. Some of the new hospital that we're designing here in Madison has no check-in counters at all, with the intent that you're getting straight to where you need to go via our in-house app that's going to direct you there for the people who have technology now. I won't go into the other side of things for this call because that's not what we're focused on. But I think when we're talking about the higher complexity, higher intensity moments, like where you're getting a life-changing diagnosis, where you're getting something where you have a really complicated multi-specialty care day that you have to schedule, those are moments that the technology at this point can't do. And maybe shouldn't do, at this point, as we're talking to consumers in the field, that's the point where they want someone by their side, a human that's going to be able to communicate things and help them through that. So that sort of complexity intensity framework is what we're using right now as we start a project, right? It's not a magic bullet, but we're able to say, okay, this is low complexity, low intensity. Let's see if we can automate it and get through its efficiency.
Right. And I think I'm glad you're bringing this up, Rochelle, but this idea of, not everybody has the same technical ability and also the same background in tech, right? So John is very comfortable walking through, a scan at the airport, but if you can't walk and you need a wheelchair and you don't have an iPhone or a smartphone, like how do you get that same level of care, right? And I think that's really where I would say technology can become very interesting, right? So is there other ways of kind of, elevating that value chain with a basically like no device or no technology on the patient side?
And that's where our role as designers and innovators is really going to influence it, right? I don't know how many of you can code. I don't know how to code. So I think we're going to be the ones that are going to have to bridge that gap between that population that you speak of and the offerings from healthcare providers and manufacturers.
Right.
Yeah,
Yeah.
that's a good example of that. Like for our oncology program, it's still technology in the background, but for the patient, it's not technology for this example. So, if we have a patient that is not using technology for their first appointment, we're able to put together a custom designed booklet with their name on it that welcomes them, that has all the information, but it's a hardcover booklet, and we're able to send that out within 2 to 3 days because of the technology on the back end that's able to connect to the HR, pull the right information. We know what their sort of appointment is about. We know what hospital they're going to. We can give them directions, but we can give them a really nice, beautiful printed booklet. There's, depending on what doctor you're going to see, there's blank pages where the doctor is able to sketch out, because we know that doctor likes to sketch the lungs, and they want to be able to show you what's going on. So some of that, I think, is
we need to
like
get that doctor on the next
to sketch.
one over here.
Yeah, right. There's some that like to have the diagram and want to walk it through, and then that patient can go home with their sketches. So yeah, I mean, it's funny when we say health tech, it's like, well, isn't everything health tech that we're working on at this point? But it depends where that tech is placed and where that is layered into the system.
You know what I've been waiting for? Sorry, Gregor.
No, go ahead.
This is exciting. I'm really engaged here in this conversation. One of the things I'm really waiting for is how you see how the pharmaceutical industry now is marketing direct to consumers and patients on television, right? Most of the commercials that you watch, apparently I must be getting old, because every TV show I watch is nothing but like pharmaceutical stuff in between. I'm still waiting for that on the medtech side though. And I don't know if that's ever going to come. It's a little surprising, or maybe even on the healthcare facility, kind of promoting the things that we're all talking about as differentiators. So it's interesting. Like, are we ever going to walk into our doctor's office and say, you know what, I really want that Smith and Nephew knee. The Stryker one sucks. Ours is so much better.
Good one.
Well, I think you see that a little bit with Da Vinci, right? Or with, like, basically hospital systems saying, we got the robot, come to us, right? So I think maybe that used to be at least a differentiator, maybe not anymore, but now everybody has a robot.
I think I go back to choice. I actually worked in pharma when that rule changed. So it was so interesting to see just the flip, like if you were to think about what your television watching looked like, however many years, 24 years ago that was, and then to today, it's amazing. But you have choice in those pharma products. The consumer involvement, the patient involvement in choosing so much of their healthcare journey feels really constrained. We're starting to see other delivery models and other payer models that are giving some people some choice for those sophisticated enough to figure it out. I mean, so I guess it just makes me more frustrated too, where that consumerization piece of it seems, it's really, really appealing. And I would love a day where more people could be watching television and learn more about their healthcare that way. I mean, there is a lot of information that comes through those ads too. I just don't know that we're there yet. I until the day where I can sit down and my household can say, gosh, we have like 5 choices here. How amazing is this to think about our healthcare for next year? Oh, I just like that's a constraint that we have to work in. It makes me think of one of the questions that's in here from Sarah, just like one of the things to think about is you really need to know your constraints and how flexible they are.
Right. I think, I don't want to go to a greater philosophical discussion around healthcare as a service, but, we are definitely shifting the way or big healthcare systems are thinking about much more of a, pay as you choose kind of subscription model, right? And I think with the emergence of software as a medical device, you see a lot more like app-based, subscription services that are now being, basically marketed towards your patient population, and almost like an app store for healthcare, where you get a certain amount every month, and then you basically spend in whatever you feel is most relevant to you, right? The question there is, is that a good model? Is that, are we giving consumers false choices, or are we elevating the care, right?
Yeah, good question. Gregor, should we answer some of the questions also that are
Yeah.
posed?
So I wanted to actually, I think Sarah, we already covered. I would love to have Kelly's question around burnout with healthcare workers. We talked a little bit about COVID and our pre-call, but basically, I think COVID has changed the way that, hospitals are staffed. I would say that, I would say the burnout is real. And I would love to hear from you guys. Is there any, on the corporate side or on the hospital side, any like discussions about technology elevating that or like helping with that? Or where is the wins for healthcare workers with the emerging tech scene?
I would say every day our projects are tying to, like, one of the number one things is to alleviate the worker burnout and the cognitive load of our teams. This is not like one project. It's like part of every project, almost like Amy was saying, it's a design principle at this point in time. I'm just thinking back to all the projects that I'm working on, and like this past week, we're trying to make data more easily seen by a physician that's only got, as you mentioned, that 10-minute 15-minute time with a patient. What is the data then that comes to the top? And as you were alluding to, Gregor, too, like, it's very important to think through that from a equity standpoint and safety standpoint. There's so many things to look at in that space. So there's nothing where we're not taking that into account. I think what's really great about this work that we do as human-centered designers or advocates on this call, I find that the work that we do gives a lot of our clinical teams life. Like, as they start to hear the patients and their voices come through, and they get to see sort of what the patient's experience is outside of that 10 minutes that they get, I think that's the reason a lot of these people joined Healthtech, because they wanted to help people's lives. And as they are able to see the human-centered design process and see the work that we're doing, I think I've gotten multiple emails from care teams where they say, this is why I joined. I want to be a part of this work that you're doing here. And so I think in some ways we have to keep doing what we're doing and do it more within healthcare systems to reduce that burnout. And we almost can't go out and ask them one more thing, like, it's not like we can go and just interview our care teams again or go out and follow them another day. Like, we have to be very tactical about how we use their time, because it's very limited to begin with. And so we have to kind of balance that in our work all the time. There's a love for it, but then there's also just a limit on how much work that they can do and how much they can engage in this space.
Right. Yeah, I mean, I see. I'm glad you're bringing this up. As we're doing formative and summative study designs as designers, a lot of times, it's also, what do we assume the cognitive load is at any given moment? They're coming off an 18-hour shift. They're coming to do a formative study, or they had 3 shifts in a row, or they had a bad day. Like, it's challenging as a designer to even understand how do we sneak into getting the feedback we need as we're doing our research.
The design process in itself, trying to figure out how to sneak in and get the feedback.
Yeah, exactly. Yeah, we have about 7 more minutes. I think, I don't know, is there any more questions I didn't cover? Yeah, so Kelly talked about burnout. Sarah had a question about healthcare system, slow pace of innovation. Yeah, I mean, I would say, there's a parallel a little bit in technology could also enable, if there is, countries around the world where the standard of care is much lower, the adoption of technologies can also broaden the reach of care, right? So we have a client that is doing, X-ray, super low power X-ray that could be done anywhere, right? So, they're really focusing on kind of like field workers, but, like even getting an X-ray machine into somebody third world countries and really having them have one is a huge change, right? So as some of these technologies are becoming more affordable and more adaptable, there's a lot of opportunity for technology to also broaden the reach for healthcare around the world. And that's same thing with, your patient populations. I'm sure are, some of them, don't have insurance. And I mean, Rochelle, I mean, if you're in a hospital system, I'm sure you have a percentage of uninsured or underinsured that come to your footsteps every day. And, potentially, how do you manage that? How do you leverage that? And how do you use technology to make that a better experience?
Yeah, and I think I'll do kind of a two for. I'll answer Sarah's question there too. I think one of the things for emerging designers that I would definitely think about is business strategy or business models. You have to understand where the money is flowing in this space. I think that's some of the challenges when we get designers or consultants that are fresh to healthcare and they come into this space and they have some great ideas but they don't understand what we have control over as a health system and what the payer has control over, like there's so much more complexity in terms of the business model. So I think that business strategy side of things, the design strategy certificates, those sort of things where they really bring in the company and the context into the design of the product that you're working on are really important. At UW Health, we have this unique situation where half of our population is capitated and half is uncapitated. That means that half of our population, it does not matter how many times they come in through our doors, we get the same check every month because they're Medicare and Medicaid, right? And then the other half of the population is paying, each time they come in. So we, are able to test some value-based systems within our population because half of our population is within value-based care model, which, a lot of folks think that's where our country needs to strive to go towards. So I think, I'm saying all of this just to sort of describe what does go through our mind as a health system when we're making decisions. We do have to be able to have the money and the support to translate these innovations into a sustainable business model.
Right. And you mentioned telehealth, right? So
Yeah.
the FDA has changed reimbursement models for telehealth. First days of COVID, it was a landmark ruling. Everybody got really excited. 3-4 years later, I feel like most hospital systems are losing money on telehealth. Doctors have a lot of burnout. They don't want to look at the screen. They want to look at the patient. There's definitely like a gap in the expectation of telehealth and what it was able to deliver. I would love to hear maybe from Amy a little bit, like, how do you guys kind of think of telehealth in the context of technology? And maybe even Rochelle, I think you said you had some pilots where you guys were like trying out some new things.
I'm going to defer to Rochelle. It's not really within Stryker's business model, so I think Rochelle would probably be able to comment better than I would.
Yeah, I mean, Wisconsin is one of the states that has the worst payer parity. That means that we don't get the same reimbursement for a virtual visit versus an in-person visit. So, our business model then is, the payers are really striving for us to get those people in person. They believe we can't deliver the same level of care. So, as Gregor was saying, we lose several $1 million a year on our telehealth program. We do it because it is needed. It's convenient. We have regional patients that can't drive into all of our clinics around the state, and we do it anyways. But we also have to think through, we've got people that are working on policy. They're working on advocating for changes in that space. But it's a bigger challenge, right? It requires, I don't know, maybe like super collaborations, where you're working with the government, you're working with the payers, you're really trying to get the space to change in the way that is going to best support the patients.
Right. So we have a couple more minutes. I want to wrap it up. I thank everybody. Maybe a round of last remarks before we wrap up. We have maybe a couple more questions we could cover, but I would say let's go around. I'm really excited about where we're going as a field. Obviously, I think we covered a lot of the discrepancies between the ideal and the realities. And obviously, healthcare is a complex system, a complex market. That the reimbursements are driving a lot of the technology innovations. I'm still looking forward to what it could potentially give us. So yeah, maybe last remarks for everybody, and then we wrap it up. I'm starting with John.
Well, I think this is probably one of the most exciting, most engaging industries to be in if you're looking to continue as a designer and to contribute from a user-centered, user-focused perspective. Um, you know, I think after healthcare, we'll probably get into the space race and how do designers help us live on the moon and Mars. But that might be, you know, for our kids to think about. But I do think there's a lot of excitement and a lot of opportunity in this space.
I'll plus
Hey.
on that. A lot of excitement, a lot of uncharted territory that we get to create the path for.
Excellent. Rochelle.
Yeah, I would welcome anybody that has that interest in health or public health and design to start looking into healthcare institutions in your area. It's an amazing, I've had the best projects in my life the past few years, being able to work in my own community and make the lives better for our patients. So I would definitely encourage you guys to continue looking into that and supporting the healthcare institutions that are investing in this.
Yep. Yeah, well, thank you. I want to thank everybody, all panelists and the people who joined. As I said, next week, Thursday, John and I and Saloni are hosting a Healthtech Mixer in person. If you can come out, please join us in Boston. If you're not in Boston, we're actually having programming done in North Carolina as well as in Madison coming up. And we're super excited to engage with the community. If you're new to health tech or you're interested in it, just come to one of those events. We can always point you in the right direction. And what Rochelle said, internships or like reaching out to hospital systems or, just like really learning more about the industry is probably a first starting point. It's not a hard industry, I would say. I mean, everybody makes it look like, oh, the FDA, there's a common set of rules that I would say are pretty understandable. Any rules need a time to get up to speed, but by no means is it a market that is very esoteric and non-approachable. Thanks everybody. We're really excited and we'll see you on the next one. Talk to you soon. Take care.